Good afternoon. My name is Cherise, and I will be discussing interactive activity number 5, which is public policy regarding Government Finance Officers Association webpage. And for this, I chose to do the budgeting and financial management. And the subtopic that I chose for that is the healthcare reform policy. And on the site, it discussed about how healthcare is now the fastest growing portion of state and local government budgets, and governments have cited rising health benefit costs as one of the main contributors to budgetary pressure. And these costs limit spending on other important public needs such as education, infrastructure, and economic development. Healthcare costs fall heavily on state and local governments. And as far as the GFOA position, the Government Finance Officers Association urges the administration and Congress to work together with state and local governments on initiatives to reform the nation's healthcare delivery system in order to contain the growth of healthcare costs and expand access to healthcare for all. GFOA encourages a federal approach that includes expanded healthcare coverage, employers who provide, which includes employers who provide health insurance, individual purchasers of health insurance, to combat higher medical bills and premium increases. They're also looking into equal consideration for all and adequate federal funding, transparency within the healthcare system, healthcare information technology, performance standards, higher quality of care, more effective, less costly medical care, affordable prescription drugs, reducing the time frame on prescription drug patents. And I'm thinking that is to prevent price gouging when only one company can or has the ability to hold on to a drug that people really need, especially for life-threatening diseases, and they raise the price on it because they're the only one that has it. So if other pharmaceutical companies can make their own versions of it, then people can access it a little bit easier. And from what I see in here, the GFAO is committed to working with federal policymakers to develop and support the healthcare reform initiatives discussed above. However, myself as one who pays into health insurance, it could be pretty confusing because now they have all these apps, and then now you have a debit card, and then they're taking money out of your check, and then they're giving you money back from taxes, and they're putting certain amounts on these debit cards, and you don't know how much is on it. It's just a lot to keep up with, and it could become confusing. And then, like myself, I just recently went to the doctor. Meanwhile, they're taking all this money out of my check, and then after my doctor's visit, they asked me for $104. So I'm just really happy that I had my HSA card on me and it actually worked. Did I know it was going to work? Do I know how much is on it? No, I'm just grateful that it did. And, I do believe that all people should have some form of health care or access to it. And I do believe that here in America, we do have that, because if you don't have, like, there's been plenty of times in my life where I haven't had insurance and I was able to go get emergency care. We have our local county health departments where we can go in and get health care. So I'm very grateful for those programs, but it could be pretty confusing and costly, when you look at your paycheck and all that money's coming out of it and you're not sure where it's going. And then when you get to the doctor, they're asking you for money. And I just hope that all these people, these important, smart people that are handling all this, get it all together. Thank you.